Tidal volume 800.
Last blood pressure was what?
130 over 70.
I have peak airway pressure of about 32.
Got a good blood pressure, good pulse.
UW Hospital, Medtown MedFlight, this is Sue.
Hi, Sue. This is Bill Evans. I'm operating in Reedsburg today, and I think I need your help.
Listen, I've kind of got a situation up here in the operating room, and I think I'm going to need to transport a patient. Are you guys up and running?
We sure are. Okay, if you hold on one moment, I'll activate the flight crew. Dr. Burns will be our flight physician. He'll be on the line momentarily.
All right, thanks a lot.
Report to the comm center for a flight request. We have Dr. Evans in Reedsburg. Looks like he's got a ruptured AAA. It's on 3258.
This is Dr. Burns, my flight physician.
It's 4 o'clock on a Tuesday afternoon, and a surgeon 50 miles away is calling University of Wisconsin Hospital and Clinics with a crisis. A 67-year-old Wisconsin farmer in the middle of emergency surgery for a ruptured aneurysm needs an aortic graft, and one is not available. Unless the patient can be sent elsewhere, he will bleed to death.
I'm going to need to transport him, and I'm hoping that you guys can come here and come directly to the OR.
And hopefully you should be able to go straight to the OR from once you arrive at UW.
Okay, we have a 17-minute flight time, and it'll take us about 5 minutes to get off.
Well, that's okay. I think I'll need that amount of time to get him ready to go.
Okay, so we'll see you in about 22 minutes.
All right, that sounds good.
Very good.
I sure appreciate it.
I trained very closely with the vascular surgeons at University Hospital and had absolutely no second thoughts about calling Dr. Aker, C.W. Aker, and explaining the situation that I was in and fully expecting him to be able to bail me out. And of course he did.
Within 5 to 7 minutes of receiving a call, University of Wisconsin's MedFlight responds, bringing immediate critical care to patients with life-threatening traumatic injuries or medical conditions. MedFlight transports severely injured trauma, cardiac, burn, pediatric, and neonatal patients, saving critical time, often making the difference between life and death. Responding to more than 900 calls a year within a 225-mile radius of Madison, a flight physician and critical care flight nurse are on board every mission. With the helicopter's 200-mile range and 175-mile-per-hour cruising speed, the patient was in sight of UW Hospital and Clinics within 40 minutes, still under anesthesia and ready for surgery.
Ground transportation would have been much too long. Once you control the bleeding in this kind of situation, you have a finite amount of time to get things sort of hooked back together. So that the role of MedFlight in this was critical.
The crew came right into the OR. We transported him onto the helicopter gurney, put him on the helicopter, and within a matter of minutes he was in the operating room at UW.
We worked very hard to treat complex illnesses. That's our job. And that's what we're here for, to treat complex illnesses.
It took 4 hours to repair the ruptured abdominal aortic aneurysm and save the patient's life. UW Hospital and Clinics is a teaching hospital, and in the operating room it is common to see surgeons work while passing on their skills to the next generation of medicine, just as Dr. Aker had trained the surgeon who called him earlier in the day.
And by the time the evening had fully gone, CW had his aneurysm repaired. He'd made a phone call to me and said things are good, and they did turn out to be quite good.
Yep. Turn out one more, huh?
Harold Pepper is back at Farmers Market selling honey and other produce with his granddaughter Elizabeth, who found him and called 911. He's thankful for his doctor, MedFlight, and the care he received at UW.
But it wouldn't have been for all of those things put together, why I wouldn't have lived.
You're watching a kidney transplant that will give this patient a second chance at life. For more than 25 years, the University of Wisconsin Transplant Program has given hope to thousands of children and adults waiting for an organ or tissue transplant. UW Hospital and Clinics has one of the largest transplant programs in the country, performing more than 500 organ and tissue transplants every year, including kidney, pancreas, liver, heart, small intestine, lung, corneal, and bone marrow transplants. Among the most dramatic of medical miracles are multi-organ transplants. UW Hospital surgeons have performed kidney pancreas, liver kidney, liver intestine, heart, lung, and heart, kidney, pancreas transplants. Following most transplants, patients are taken to the new UW Trauma and Life Support Center. Equipped with 24 beds, this is the medical center's major intensive care unit, handling all critically ill patients, 1/3 arriving via med flight, another third from trauma accidents, and the final third transferred from floors within the hospital. Each TLC room features the latest in advanced life support technology.
When people see a unit like this, they get very taken up with the technology that's involved, and certainly there is a good deal of technology involved. But what I think we're most proud about are the people who work here, and I think that's really what makes a unit like this go. They need to be tough. I'd like to think they need to be smart. They need to have a good sense of humor, and above all, I think they need to be dedicated to what they're doing, because it's a very difficult job, I think.
The job can be even more difficult when the patient is a tiny child. At the UW Children's Hospital, a parent's hopes and dreams come through the door every time a child is brought into pediatric intensive care. Here, physicians and nurses are skilled not only in delivering sophisticated medical care, but also in talking to children in a comforting way. UW Children's Hospital is a specialized care facility within UW Hospital and Clinics. Tonsillectomy is a standard procedure, but not if it's your little boy about to undergo it. The staff at the UW Hospital and Clinics Outpatient Surgery Center understand, and parents are allowed to go with their children into the operating room and stay with them as they are anesthetized.
She's going to help. She's going to hold your hand. There you go.
Here, Matt. Mom's still here.
That's just good. He just saw you and he just drifted off to sleep.
More and more surgeries are being done on an outpatient basis, a trend UW Hospital and Clinics can accommodate with its complete outpatient surgery center. Knee arthroscopies, breast biopsies, and cataract removals are among the most common procedures performed here, with the surgery done in the morning and the patient home by night. While Barney waited outside the operating room door, Matthew George's tonsillectomy went well.
Everything went great. He's waking up now on the table a little bit. As soon as he's a little bit more awake, we're taking him back to the recovery room and you can join him there.
Physicians at UW Hospital and Clinics are on the faculty of the University of Wisconsin Medical School, and their research often changes the way medicine is practiced. Dr. Tom Sudeblick and David Mavi announced using the laparoscope for spinal fusion to shorten the procedure's recovery time. Doctors Robert Menser and Anthony D'Alessandro performed the second heart, kidney, and pancreas transplant in the country. Dr. Bruce Harms advanced bowel reconstruction procedures at UW, allowing patients who have had a history of inflammatory bowel disease or certain types of colorectal cancer avoid an external ostomy. Research by ophthalmologist Suresh Chandra shows lasers can slow the deterioration of eyesight caused by macular degeneration, while new research is looking at whether antioxidant vitamins and zinc can prevent its occurrence. Doctors Henry Schuda and Charles Struther are studying whether a new stroke treatment can reestablish blood supply to the brain during a stroke before permanent neurological damage takes place. And at the Women's Health Center, low-price mammograms are offered year-round to help physicians like radiation oncologist Judith Stitt treat breast cancer in its earliest stages when women have the most treatment options. UW Hospital and Clinics is affiliated with a strong network of primary care providers throughout South Central Wisconsin. Ellen Gabriel of Brooklyn came to the UW Women's Health Center when she was pregnant with her sons, and now she uses the UW Middleton Pediatric Clinic. A pediatrician for 20 years, Dr. Richard Rice says his primary care patients like having access to medical students and residents.
It's great. The residents were wonderful. You know, I've gotten so many tips from so many different people, and I think, well, while we have the constancy of Dr. Rice, and I have the constancy of, my primary physician, the other people we encounter also have a lot of information.
Some UW physicians wear many hats. Dr. Greg Landry is a UW pediatrician who works in sports medicine and is the head medical team physician for the Wisconsin Badgers. When he's not on the Badger sideline, he's on the front line of primary care medicine.
I like being a pediatrician because I think we're all kids. We're just different ages. Much of primary care is deciding when to ask for help from a specialist. And one of the advantages of being in a large hospital like University Hospital is having them readily available. And they're just a phone call away or a walk down the hall, and I've got my answer for the patient.
For 15-year-old Garlisa Hackboard, the answer was arthroscopic surgery for torn cartilage, and with rehabilitation, she's already back on her high school volleyball team. Blending primary care and specialty medicine meant state-of-the-art care for Garlisa. Perhaps nowhere is state-of-the-art care more important than the UW Comprehensive Cancer Center. Families like the Fayrams know that firsthand. When their son Justin was 13 months old, they noticed his abdomen was distended. Tests showed a bilateral Wilms tumor or cancer in the kidneys, and their doctor in Rockford told them to go to the UW Comprehensive Cancer Center in Madison.
We immediately came and we were seen by Dr. Sondel Friday night. We got here about 9 o'clock, and Dr. Sondel was waiting for us when we got here.
When you were going through an emergency or crisis situation, the response time was almost instantaneous. And I think that follows all the way through to the nursing staff and their response to crisis situations that people going through major illnesses like this are confronted with.
The little 1-year-old with cancerous tumors in his kidneys is now 8 years old. And Justin is far more concerned with his next soccer match than with a life and death battle with cancer he doesn't remember. The University of Wisconsin Comprehensive Cancer Center was established in 1973, one of 27 centers in the country designated by the National Cancer Institute as comprehensive. It has an international reputation for cancer research. Pediatric oncologist Paul Sondel says now 70% of children diagnosed with malignancies previously considered fatal beat the odds, like 10-year-old Carol Marlett of Rhinelander, who had leukemia when she was 2.
Seeing children like Kara gives us the strength and optimism that there's real hope out there. So back in 1972, it was the rare child who was going into remission and staying there, and now it's the majority of children. So I think that this 20 years of progress has really had a dramatic influence.
The woman signing this poster is the woman on the poster, who wants every pediatric oncology patient to know there is hope. Supermodel Cindy Crawford's younger brother died of leukemia in the mid-70s, but she remembers the care he received at the UW Comprehensive Cancer Center, and she returns to show her support for current patients and their battles. The delivery of health care is changing, but at UW Hospital and Clinics, the commitment to excellence will not change. Patients will always be the focus of the work done. It is their hope for recovery that spurs us on to deliver the best in health care, to apply the most effective technologies and treatments, to integrate knowledge gained through research, and to bring skill and compassion to the care of every patient.